Welcome to Sleep Better TV. I'm Tasia Custodi, and my guest today is Dr. Dawne Slabach of the Craniofacial Care Center in Columbus, Ohio. Thank you for joining us once again, Dr. Dawne.
Thank you for having me.
I'd like to talk a little bit about a really common problem, snoring. So many people do it. So, Dr. Dawne, what is snoring?
Snoring, very simply, is an anatomical dysfunction where the tongue falls back into the throat, vibrates against the soft palate, and makes that wonderful buzzing sound and noise that we are all aware of.
So it's fair to say a lot of people snore. So when is snoring dangerous?
Well, about 90% of patients that have what's called obstructive sleep apnea snore. Not all snorers have obstructive sleep apnea, but pretty much all patients with obstructive sleep apnea snore. The danger with snoring by itself is that over time, the tissues in the back of the throat that are vibrating can become inflamed and swell and lead to more severe forms of sleep disorder breathing, such as obstructive sleep apnea. We just don't know which snorers have obstructive sleep apnea and which do not without a diagnosis.
So if someone does snore, at what point should they be treated, and really how should they be treated?
Well, many dentists tell me, well, I only treat snoring. Well, it's because we don't know which snorers have obstructive sleep apnea and which ones do not. I will not treat anybody who snores without having a sleep study first, diagnosed by a medical doctor that they do indeed have primary snoring, or if they have the more life-threatening disease of obstructive sleep apnea.
Thanks again for your time.
Thank you for having me.
My guest today has been Dr. Dawne Slabach of the Craniofacial Care Center in Columbus, Ohio, and you have been watching Sleep Better TV.